Isolation and curfew measures have notably led to our population struggling with mental health. But is there another pandemic looming as the pandemic continues? In 2019, we saw a surge in opioid related deaths. British Columbia, deemed ground zero for opioid related overdoses, faced a higher amount of overdoses for the first half of 2017 compared to the entirety of 2016. I'm your host, Savannah Craig, and, and in today's episode of Local 514, we'll be looking into the rise in opioid related deaths during the pandemic and what needs to be done to curb these increases. Last year, opioid related overdoses doubled in Canada compared to 2019. For BC, Alberta, and Ontario, they were hit the hardest. Montreal faced a 50% increase in opioid related deaths. To understand the numbers more, here's a breakdown of statistics by province from 2019 to 2020. Ontario recorded the most new deaths of any province, with over 2,000 opioid-related deaths in 2020. This was up from over 1,300 deaths in 2019. In BC, there were over 1,600 deaths in 2020, compared to just over 900 in 2019. For Alberta, there were over 1,100 deaths in 2020, compared to just 615 in 2019. And finally, in Quebec, in 2020, there were 547 deaths, compared to just 414 in 2019. For Ontario, Alberta, BC, and Quebec combined, 82% of the deaths involved fentanyl in these drugs, and these were from males anywhere between 20 and 49 years old. Earlier today, I spoke with Alexandre Langevin, the Drug Checking Service Coordinator at GRIP Montreal, a harm reduction organization in Montreal. We spoke about how the pandemic has affected overdoses in Montreal. Here's the clip.
We've spoken before about this, I believe, back in 2017, so it's been a little bit of time. But considering overdose, sometimes when we think of overdose, we think of very lethal drugs like heroin, fentanyl. But sometimes overdoses can be caused by, I guess more commonly used things like cocaine or MDMA. And sometimes this is actually due to being laced with potent opioids like fentanyl. In your work at GRIP, what are the most common lethal mixtures you've been seeing during the pandemic and the last few years that the opioid crisis has, I guess, been strengthening?
Sure that people tend to overlook certain drugs when it comes to overdose risks. We often think of fentanyl first, and that's true that we see more and more fentanyl in the rave scenes, the rave scene that GRIP is in too. But I would say that the majority of overdose deaths are associated with multiple substances taken at the same time. And sometimes it's not only more than one unregulated drug, but also mixed with the interaction that regular medication can have with those mixes. So we tend to forget that the medication we're on can also add up to the mix. But in terms of unregulated drugs that we take that could be at higher risk, I would say that depressors, so like, yes, opioids like fentanyl, heroin, and codeine, etc., but also benzodiazepine like Xanax, Ativan. We see more and more mix of those two kinds of depressors together without people knowing it when they buy the drug. So that's really something kind of new the last couple of months or the last year since the pandemic. But also in the rave scene, I would say that people tend to forget that the drugs that you're taking might not be what you thought it would be. So, for example, you're taking ketamine, but maybe it's not only ketamine, and you have some drugs in there that changes the effects. People tend to think that ketamine is a drug that you cannot overdose with. If it was pure, maybe, but it's it's less likely to be pure than everything else. So I would say alcohol also in the mix is something people forget, but alcohol tends to potentialize the risk of overdose. And when it comes to stimulants, we gotta keep in mind that in our province, it's really rare that we have amphetamines in speed, but methamphetamine, it's really more common and it's more potent. So it's something to keep in mind when you are dosing and dancing also.
Thank you so much. Could you explain a little bit about what are some important practices to reduce overdoses, I guess overdoses of any kind?
Well, first, I would say try not to use alone. And that's one of the things that is really has been difficult with the pandemic and the confinement. But to have someone with you or near you that would be able to help you or call an ambulance if needed is really something that could change everything. To start low and go slow when it comes to dosage. If you're mixing, try to have a even lower dose of both or the different substances you're about to take. Of course, mixing is more at risk. But you can always add up some more if you feel it's not high enough. The high is not enough, but starting low is really important. To carry naloxone, and lately up to 6 doses can be pretty common and necessary to pause an overdose, an opioid overdose. So remember to have more than 2 doses with you, ideally. And try not to use in places where you would be difficult to find. At least inform someone you trust about what you're about to use, where and when, so someone can check up on you. If possible, of course, use the supervised consumption sites in Montreal, Cactus, Spectre de Rue, L'Anonyme, and Dopamine. But also if you can just have a friend or someone with you, it's really important. If it's accessible to you, check your drugs before using also to know a bit more about what's in it. Cactus opened their drug checking service called Checkpoint in July. So now in Montreal, it's possible to go check your drugs. It's open from Wednesday to Friday, 12 to 8 p.m. And Gripa also has his new drug checking mobile service. We are opening on Thursday this week, 21st of October. So yeah, I would say ideally take some pauses also when you're using for several times in a day or several days a week. Try to take some pauses to rest. Try to take care of food and water is essential, and sometimes if you have a lack in those elements, it's you are at higher risk of overdose.
For those who want to use the mobile service that Grip will begin offering, whereabouts can we notice it in Montreal?
We'll be operating only on Thursdays for now, from 3 p.m. to 9 p.m. And we'll start by being parked at La Fontaine Park and Jeanne Mance Park. So the first 3 hours at La Fontaine Park and the second 3 hours at Jeanne Mance. But it could change because we want to be accessible for supervised consumption sites. So we will be at shelters also. So follow us on Facebook and our website to know more about that.
Thank you. What would you like to see the city of Montreal do that they maybe haven't done yet in order to reduce overdose rates?
Well, I would say less policing of people who uses drugs. We have a lot of police presence in Montreal, and hiding from the police and using alone is one of the dangerous risk factors contributing to overdose. And specifically during the pandemic, because at night with the curfew, less and less people were just walking by, so it's easier to get caught by the police when you're just about to use harm reduction services, maybe, and you're less likely to go seek services if you're more likely to be stopped by the police. So that's one of the contributing factors in the past year and a half. I would say that more money and more exemption to the law to open overdose prevention sites, such as supervised consumption sites and drug checking services. We need more of that in Montreal to answer all the needs. But for that, we need money. Decriminalization, of course, in Montreal, all over the country, ideally, or all over the world, if we're dreaming. But just the fact that it's illegal to use drugs, you're less likely to go seek some services, to talk to your doctor, to talk to your pharmacist or a friend, even to tell them that, well, maybe I need someone to know where I will be using. Maybe I need to have more information about how I can have safer drug use. So more shelters where drug use is accepted also would be essential.
Thank you. Considering candidates like Denis Coderre and Valerie Plante in the upcoming municipal elections have pledged to give the SPVM more money, do you find this troubling in terms of actually addressing overdose rates and helping people who use?
Yeah, absolutely. And I mean, SPVM never had any cuts in their budget, and I think it's clear that the strategies that Montreal has been using to reduce overdose, it's not enough, and the policing of people who use drugs has just increased in the last year and a half. So increasing police presence or budget, I don't see how it will help people. For this matter, I really don't see how.
And I know that you already touched on this a little bit, but could you explain a bit more about how isolation and measures like curfew in Quebec has played a role in rising overdoses?
Well, since the pandemic, the drug quality decreased. We are seeing more potent opioids and benzos in circulation, and even more in stimulants sometimes. So it's getting more difficult to know about what you're about to use. Everything is more potent all suddenly, so it's harder to dose. But also the past few years, the summers are hotter and stimulants are more potent. So without enough shelter from the heat, we see increased rates of overdose deaths by stimulants in those circumstances. And with the isolation confinement during the pandemic, all essential harm reduction services and shelters were less accessible. Some of them had to close because they didn't have the equipment, the money to have all the protection equipment for their employees at first. But even when they are open, like I said earlier, people are less likely to go seek help if there's a curfew, and you don't want to have your drugs on yourself when there are police everywhere not knowing what to do because there's no one outside. Even if you're going to use a essential service, you're more likely to be stopped and maybe frisked. People had less access to safer drug use materials also. So there's more infections and transmission of HIV and other diseases by reusing and sharing the material. That's something that is not linked to overdose, but it can lead to death or illness also.
Thank you. I know that GRIP, alongside harm reduction, also provides education. And I wanted to talk about this a little bit with you, especially considering stigma. Why is reducing stigma vital to overall reducing overdose rates and, just providing more help for people who use drugs?
Well, because of the stigma, our government and the general population seems to think that it does not concern them when we see an outrageous increase in overdose deaths. It seems like it's not enough to justify change and more care. Stigma plays a lethal role in this overdose epidemic. The fear of people who uses drugs isolate them, marginalize them, puts them in a box. It's the stigma and racism in false association of what a drug user should look like that built the laws prohibiting certain drugs while promoting others. It's not science that's behind this prohibition. So it's harder to access crucial information about drugs when you're a drug user. It's harder to access health and social services without being judged. You're more likely to be criminalized without having done anything else than using drugs for yourself. So I think education, we still have a lot to do concerning the reducing of stigma.
And how does GRIP provide education to reduce stigma? What does this look like?
It takes different form. When we work with festivals and raves, for example, we want to work with the organization before the event, for example, so to make sure that their employees, the security are all informed of what to do when someone seeks help because they have a bad trip or because someone is overdosing somewhere on the event. So we provide training so people just have more empathy, really, and just have a reaction that helps us provide better services on the ground. But we also give education in colleges and universities. We work with the professionals that works with the students to make sure that everybody is more equipped to recognize, yes, when someone needs help because of addiction, for example, but also provide more information about harm reduction. How can I reduce the risks if I don't want to stop using drugs? Maybe people don't have addiction also, and that's something that is forgotten. The majority of people who use drugs are not people with addiction, or not people with problematic use, even when we talk about unregulated drugs. So it's something to keep in mind and to give a more realistic portrait of people who use drugs. I think it's more helpful in reducing the stigma, but it's still we still have a long way to go. So yeah, I would say that the tools, information, the training, we give conference and anything that schools would ask us to do. We always put up front that we will do a part on how stigma is harmful to people who use drugs.
Thank you. Aside from education and reducing stigma, is there any other way, any other things that our society essentially needs to do to move away from the war on drugs tactic of just, don't use, stay away from drugs, these type of things?
I'm not sure I understand the question. So what society needs to do other than say no to drugs?
Yeah, like how can we move away from this kind of rhetoric?
Well, I really think that, again, having a realistic portrait of what it's like to use drugs, of how someone looks, how someone that uses drug can look, because we always we use fear tactics, and when people fear, they are more likely to stigmatize and not wanting to understand or hear even the version of the person that uses drugs. And I think that's the most harmful thing to do. When we fear someone, we put them aside. And we need to realize that people can use crack and not be aggressive. People can be productive members of society and use drug like occasionally and regularly. Even someone with an addiction is not necessarily someone that will let the people they love down. So there are many harmful associations between drug user and how those people behave, and it's harmful and it's false. It's really false. So we have to know that even if someone has an addiction and maybe is not working or is living in the street, everybody deserves the respect, and we don't. Marginalized groups often have to be exceptional to earn the common respect that everybody else's does. So I think for drug users, we're not there yet. Also, we need more maybe researchers and doctors coming out and saying that they do drug, and they are still, worthy of love, still worthy of respect. But I think it can emerge another problem, that you don't need to be a doctor to earn respect when you use drug. But we are not there yet.
Thank you so much. Lastly, I just want to ask, in your time at GRIP and maybe even before, have you noticed problematic ways that students are taught about drugs within their education? And maybe are there certain ways that our education system can adjust, whether it's university, elementary, high school, different levels?
Yeah, absolutely. And when I first started at GRIP as an employee, I was working in high schools, with different high schools in Montreal, and cégep all over the province also. And in some places, it's really good. Like, it evolved, but our education system isn't equal. Some places can have, like, really the drugs are a bad tactic, and really harmful tactics when it comes to trying to detect which student is maybe using pot. And when they do detect them, some of the schools can, or some of the teachers can be really stigmatizing. And I have to find my words right now. Just a moment. What I saw is sometimes people making really the association that the student is using pot, the student doesn't have a future. And that's still something that I hear less often, I think, than maybe 10 years ago. But it's still a practice, like, to try to put this student out of the group, which is not helpful at all. And in our education system, we are just beginning to have drug harm reduction, not even harm reduction, but drug counselors, drug addiction counselors in schools. So that's something really important, to have at least one professional in the school that does know what they are talking about when it comes to drugs. So real information can circulate in the school, and students that are using can have some tips and tricks of harm reduction and not only stop using advices.
When we speak about harm reduction, it's important to understand the drugs themselves. So what is fentanyl? It's a powerful opioid used as a pain medication. It's also used together with other medications for anesthesia. We can also see it used as a recreational drug, sometimes mixed with heroin, methamphetamine, or cocaine. Its potentially deadly overdose effects can be neutralized by naloxone. But is it the most deadly? No. Less common, but still seen on the streets of Canada, is carfentanil. It gained prominence in Canada in 2017. Carfentanil is a structural analog of the synthetic opioid analgesic fentanyl. It is approximately 100 times more toxic than fentanyl itself, and it's 10,000 times more toxic than morphine. Carfentanil can be deadly in extremely small doses. So what are the signs of an overdose? Cold, clammy skin, a limp body, seemingly deep in a sleep, slow breathing, a faltering or halted heartbeat. These are the signs. So what should you do? Call 911 immediately. Someone should check if the person's breathing. If it's slow or shallow, inject naloxone to regulate their breathing. If naloxone is not available, administer CPR to help a person breathe until the first responders arrive. If the person's breathing is compromised, a lack of oxygen can cause brain damage within minutes. So it's vital to call first responders immediately. So how does naloxone work? In 2018, a McGill social work student, Richard Davey, gave free trainings on how to administer naloxone. Naloxone can now be picked up for free at your local pharmacy, either in needle form or available as a nasal spray. Here's a clip of Davey explaining how to inject naloxone.
So the first thing to be aware of is it's really hard to know if someone is overdosing on opioids. They're not going to be breathing well or not at all. Their eyes are going to be pinprick. The skin is going to be clammy to the touch. And they are going to potentially have blue lips, blue fingernails, that type of thing. So I'm going to see an individual who I believe is overdosing, and I'm going to try to stimulate them. I'm going to potentially rub them hard on the sternum with my knuckles. This is an area where it would normally cause a great amount of pain. If they don't respond to that, you're fairly sure that they're out. No response to that, then I'm going to open the airway. Once the airway is open, I'm going to make sure there's nothing in the throat. So after you've ventilated, then you're going to evaluate. There is this called Narcan. This is also naloxone, just the same way that the vials are, but this is a spray that goes into the nose. So what you would do with this, block one nostril and push the spray up into the nostril. Where we would administer the medication, it's intramuscular. So we're talking about the shoulder, we're talking about the thigh, or we're talking about the buttocks. So what I would do is I open up the syringe from the packet. But basically these, it's just a standard sort of glass vial. So you use that to break it. Now you've just got a little open glass vial that you can suck up the liquid from. These are retractable needles. If it's this one, then I'm just going to put the needle in and I'm going to suck up all of it. Then you're going to push all the air out and you're going to tap the needle to get rid of any air bubbles. I'm going to take an alcohol swab. I'm going to rub it on the area that I'm going to administer the medication, and then I'm going to administer the medication at a 90-degree angle. And I'm going to push the liquid in until the needle clicks. So what I'm going to do with this one, this is a little bit different. So what I need to do first of all is take 1 milliliter of air into the syringe. I'm going to put it into the vial, and I'm going to push the air into the syringe. Take the needle kind of almost all the way out, and then you're going to suck out the liquid. A 90-degree angle through clothes, if necessary. Something to know at this point is they may potentially be, they could potentially be aggressive. When they wake up, they might not know what's happened. You've effectively just put them into immediate withdrawal. And make sure you stay with them until the ambulance comes, because this naloxone only works for about 20 to 90 minutes, depending on the way you read it, whereas the half-lives of the opioids are maybe 12 hours.
Opioid, metonitazine, was seized this summer among other drugs busted in the Ile-Bizard-Saint-Geneviève borough. This is the first time this was found in Quebec. The drug was spotted in other parts of Canada last year. Fentanyl seizures are becoming more prominent in the province. So if law enforcement are continuing to seize these substances and people are continuing to die from overdoses, how can the situation be aided? Harm reduction is a method. Earlier today, I interviewed Siobhan, a street worker from Head and Hands, an organization located in Montreal. We discussed what needs to change in our society to reduce overdoses and to better support users.
Yeah, so I'll just give you some context about like maybe a little bit about Head and Hands and then my role with Head and Hands. So basically, Head and Hands is an organization that I think has been around since the 70s. And so we provide medical, legal, and social services to youth of Montreal, but specifically NDD. And so, yeah, today it looks a little bit different because of COVID, but typically there's like drop-in medical clinics. Like right now it's not drop-in. You have to make an appointment, but yeah, we have a medical clinic, we have legal sort of information and consultations, there's counseling, and then there's also like a young parents program. There also was or is, I'm not sure where we're at right now, but there was like a SENSE program that did sex ed in high schools basically. And like overall, our organization, kind of our approach, I guess, is preventative, inclusive, non-judgmental, and like holistic. So we're trying to facilitate that with like the empowerment of youth based on their needs and meeting them where they're at. So as a street worker, I kind of take those approaches to the street. And so there's not like a fixed role like you've mentioned that I have, but so I do everything and anything from, yeah, handing out safer sex and drug use gear. I accompany people to appointments like medical. I've gone to court with people. I help people navigate like bureaucracy, whether that be applying for like a RAMQ card or helping them find housing or like going through the bureaucratic steps to go on like social assistance, anything like that. I fight with the city a lot. Do things with just like active listening. So that could be just like having coffee or lunch with people. Sometimes do crisis intervention. Yeah, anything and everything.
Thank you so much. When you say fight with the city, is this kind of specifically for more rights and aid for users and things like this?
Yeah, it's not a big part of my job or whatever. I was kind of being facetious there a little bit, but yeah, sometimes like most recently there was a man who was living in the park that houses Head and Hands, and it's been a very contentious issue with us in the city and the neighbors, so that kind of thing.
Thank you. I know your role at Head and Hands, it's a bit newer, but you know, during your time at this organization, have you seen the culture and attitude towards harm reduction in Montreal or Quebec change at all?
So yeah, I was thinking about that, and it's kind of hard to measure, I think, like cultural shifts until it's in retrospect. And I also like live in a bubble. I feel like my peers and my friends are all, you know, our attitudes towards harm reduction are like positive or So that I don't, it's hard to tell, but I think something that, I mean, for me, that question kind of leads into like, I don't know, like, I guess the forces that uphold like the systems that we're in. And for me, I think public and cultural attitudes are very important, obviously, but I think what my focus or how I look at things is kind of like building movements that pressure or yeah, pressure sort of like politicians or people who hold power or make policy. So in that regards, no, but yeah.
Why is harm reduction essential in reducing overdose rates?
Okay, so I think, yeah, if we talked about like what are contributing factors to overdose rates, which would be like lack of housing, lack of like good healthcare, like the stigmatization of drug users, and just the hierarchy that formed what drugs are good and bad. And it's always the most vulnerable people that I think bear that burden. But yeah, to so I think attacking all the reasons that play into what is happening in the overdose crisis, which is like very complicated and deep. Those are the ways, I guess.
You know, as you know, we live in a society that is much more focused on the war on drugs rather than focusing on things like harm reduction, things that you and other people at Head and Hands are doing. You know, why is this kind of war on drugs approach that our government has had for many decades? You know, as you know, and I've seen, you know, I think there's been a little bit of a cultural shift in embracing things like safe injection sites that, you know, we hadn't had for so long. But overall, why is the war on drugs harmful for people who use and doesn't actually deter people away from using drugs?
Yeah, good question. I feel like, yeah, for sure, that's a good point about like safer injection sites, but I feel like those things are definitely demonstrative of like moving towards that thing, but like, yeah, it hasn't really changed. Like, I feel like we live, like, it's based on fear. I think people are scared. The narratives around like drugs and crime and that kind of stuff all play a factor in that. And I think that lots of people have the mindset of like, if people who use drugs are just like lazy or non-motivated, and if you just like had a job and you know were productive in that sense, then like you wouldn't be where you are using drugs and stuff. Like very like not a holistic approach to thinking about people and drug users. And so that's why the war on drugs is really problematic, because it over criminalizes already vulnerable people. So people that are unhoused or have access to very precarious housing are often caught in that system. Yeah, people that are already like overly criminalized, so racialized people, just poor people, like basically people, yeah, poor people. People don't like poor people. The government doesn't want to support poor people because, you know, we're seen as, I don't know, in capitalism, we're supposed to be productive and not, yeah, like making money. So I think that's why the war on drugs is hard, and also why it's hard to shift people's mentality about drug users and the stigmatization of drugs and drug users, for the reasons that, yeah, for the reasons that I mentioned before.
Considering people who face poverty, are there other groups that are maybe more vulnerable to overdose and use, and how could they be better supported?
Yeah, so like I mentioned before, there's definitely like a hierarchy of drugs, like we know that pot was just recently decriminalized. But before that, people would be sent to jail for, I don't know, like selling weed, non-violent offenses. And I feel like the prison system just warehouses like people that we find nuisances, or, it like plays into our fear of what people who are involved in like the black market, how, how, how they are. So yeah, unhoused people or people with precarious access to housing. Also, like, yeah, I don't know. Um, I feel like we often are like the kind of work that I do, like not to undermine like what I do or say that it's not important, but I feel like it's a little bit of a band-aid solution to the larger, to the issue, which is drugs being decriminalized, so people have access to safe supply, and housing. Those are all, I think those are like the foundations for the crisis, or to end the crisis.
What would you like to see done by our municipal and provincial governments, maybe even federal, in order to reduce overdose rates and just overall help people who use drugs?
Yeah, so it's the same thing: housing, decriminalization, and so people have access to like a safe drug supply. It's not like I think a lot of people think about like drug users and that it's just like we have it, like people just want to get off drugs, or like yeah, but some people don't want to get off drugs. Like drugs are fun, people like to use drugs. Certain drugs are deemed better or more acceptable than other drugs. So I think like the whole thing has to shift, and the only thing that can really prevent deaths is access to like better social care, which is housing. Just in the year and bit that I've been working at Head and Hands, like it's wild to try and get people adequate housing. Like it doesn't exist at all. People just want the unhoused people out of the parks, but that has been proving like when I was talking about fighting with the city, it took like many organizations, many people working within those organizations, plus the city, plus even the police, to try and get one man housing from the park. And right now he's in a shelter far away from his community. Like his mom is an 84-year-old woman. That's why he was living in the park, like just across the street from her house. But now he's like living in a shelter downtown, which is totally a band-aid solution. But like there's no housing for people.
So essentially, things like social housing, maybe lowering rents, things like these will provide, I guess, more support.
Well, yeah, it just like gives dignity to people, but also the whole like kind of like you were talking about before, kind of like a cultural mind shift, I think needs to happen about drugs. But that's not something that the government can do. They can only decriminalize drugs so that drugs can be regulated and that we know what are in the drugs. So when people are taking drugs, they know what they're taking. That's the only way. Mm-hmm. Putting people in jail, it doesn't work. We're like, like you were saying, the war on drugs has been raging on for a long time, and here we are.
That's all the time we have today. Thanks for tuning in to Local 514. To keep up to date with future episodes, follow Local 514 on YouTube and follow CUTV on Instagram, Twitter, and Facebook. See you next time.